Perfect. Thank you so much. Again, I apologize for the late start. Please forgive the technical difficulties. Um, my name is Elizabeth Robinson. I am with Health Alliance Plan, one of the sponsors of the West Bloomfield Chamber of Commerce. And I would like to welcome you to my presentation today, a breakout session of the basics of Medicare. So thank you very much for taking the time. This is me. I do have almost a 10-year 10 years now in with HAP. That anniversary is coming up in early December, so almost exactly 10 years. Started in customer service, moved into the sales department with individual and family plans, and now I work specifically with Medicare beneficiaries and really enjoy trying to help provide a little bit of insight as to this complicated and complex topic. So what I'm going to go over today are kind of the basic parts of Medicare, the different types of insurance that you can get to go along with your original Medicare, and what are the different timelines and steps that you can take to make sure that you are enrolled in the best plan for you or your loved ones if you're assisting them. Pardon me. So I like to dive right in with what I call the alphabet soup of Medicare. This is where the introduction gets a little bit interesting because there's lots of letters and abbreviations in the world of insurance in general, but very much so in the case of Medicare specifically. My friend refers to this as the alphabet soup of Medicare. So I'm going to start with parts A, B, C, and D. Some of this information may be very familiar to you, some of it may not. So I just like to kind of level set the playing field and make sure that people understand the different pieces and the terminology that is used because it is kind of specific to Medicare. So the first piece, pardon me, is what is referred to as original Medicare. This is part A and part B together. These are the two pieces that are given to Medicare beneficiaries by the federal government. And by given, I mean that Medicare beneficiaries, for the most part, have worked at least 40 quarters or 10 years of your careers paying into Social Security taxes. That tax money has prepaid for these two pieces of insurance that Medicare then gives to you upon being eligible for Medicare. So Part A is generally understood to be your hospitalization coverage. As in fact, matter of fact, on your red, white, and blue Medicare card, it'll say hospitalization A and then a start date, and then it'll say medical B and a start date. So Part A, generally speaking, is hospitalization coverage, inpatient hospital, outpatient, inpatient hospital for the most part, but it does include a couple of other services like skilled nursing and some home health care. But for the most part, it's kind of like room and board when you're hospitalized. Part B, on the other hand, is all of your outpatient medical care. Strictly medical services only, no additional benefits included. So there's no vision hardware, there's no hearing aids, there's no dental, there's no prescription. So strictly inpatient hospital, outpatient medical. The general understanding is that Part A and Part B together leave you as a beneficiary with a responsibility of about 20% of the cost. Medicare will cover about 80%, leaving you with about 20%. There's no cap to that 20%. So that actually is why a lot of people who are Medicare beneficiaries elect additional insurance to go with Medicare Part A and Part B to help reduce or even eliminate that 20% gap in coverage. So it's really important to figure out what the right type of insurance to fit your needs as a beneficiary to go with Part A and Part B. Pardon me. Part A generally has no premium per month. That's something that usually your Social Security taxes have prepaid for. If you have not worked 40 quarters or 10 years, you and or your spouse collectively have not worked at least 10 years, then you may have a premium for Part A if you're still eligible for Medicare. That's determined by Social Security and your IRS taxes. Part B, however, has a premium that everyone has to pay. It's always paid directly to Social Security. It is never paid to one of the carriers that you would choose insurance from. It's always paid directly to Social Security. If you are accepting your Social Security payment each month, Social Security will automatically deduct your premium for Part B from your from your Social Security payment each month. So payment is kind of seamless for most people at that point. If you are not yet receiving your Social Security payment each month, don't worry, Medicare will bill you. They're going to send a quarterly invoice, so 3 months at a time, to pick up that Part B premium that you will pay directly back to Social Security. One other detail about Part B before I move on to the other pieces is that if you do not engage Part B when you become eligible for Part B, unless you have what's considered creditable coverage in place. In other words, if you're a full-time employee and you have a health benefit offered to you by your employer, that's considered creditable coverage. But any other type of insurance is not considered creditable coverage. And if you opt out of Part B when you become eligible for it, if you don't turn it on, there will be a late enrollment penalty at a later time when you do want to turn it on. That late enrollment penalty is a monthly penalty and it follows you for the rest of your life as long as you have Part B coverage. So the moral of that story is to make sure that you're turning Part B on when you become eligible unless you have that creditable coverage in place. There's no way around that penalty if that is something that you incur. So Part A, Part B, again, medical coverage only for inpatient and outpatient covers about 80% of the cost. So what's missing from that most noticeably is your prescription piece. That is Part D. I always say Part D is in drug. So Part D coverage is some additional insurance that you select as a beneficiary. So you choose it from the carrier that you feel comfortable with and offers the plan that fits your needs. Part D can be a standalone prescription drug plan, or PDP for short. See, there's lots of letters. PDP for short, or it can be wrapped up and included in a Medicare Part C plan, which is also known as Medicare Advantage. That's one of the two types of insurance that you can choose to go with your Part A and Part B that helps reduce that 20% gap. I'll define a little bit more about Medicare Advantage in just a couple of moments, but I want to spend a little bit more time talking about Part D before I move on. Pardon me. It's fallen. Allergies are rampant for me, so sorry about that. Part D is governed by all the rules and regulations of Medicare itself. And everyone who has Part D coverage, with only two exceptions, everyone is subject to a set of limitations that Medicare itself designs for prescription coverage. This set of limitations is called the coverage gap for prescriptions. It's also referred to as the donut hole. A lot of people have heard of the donut hole, and usually there's a groan attached to that because the donut hole is usually not a pleasant experience. Usually it means that prescriptions become much more expensive. So just a really quick kind of overview of what this set of limitations or the coverage gap is. Medicare designs different stages throughout the calendar year that you would pass through according to the cost of your medications. They track your utilization, and as you hit certain benchmarks of cost of your medications, you pass from one stage to the next. Going from one stage to the next, how much you pay out of your pocket can change, and it can change pretty drastically. So really being aware of this set of limitations and being prepared for it are the two best ways that I can arm you to be able to deal with it. In order to help you with that process, the carrier that you select your Part D coverage from, whether it's a standalone prescription drug plan, a PDP plan, or if it is wrapped up in a Part C Medicare Advantage plan, the carrier that you select will provide you with a monthly report that will show you how much you paid out of your pocket that month, how much the plan paid for you that month, and how much is counting towards your out of pocket maximum that year to date. They will also tell you exactly which stage you are currently in. You can use this to track and project when or if you will enter into the dreaded donut hole or the coverage gap where cost of your out of pocket costs for your prescriptions could change. There's a lot of information available on the internet if you do a search for the coverage gap or the prescription donut hole. There's a lot of information that is out there, a lot of articles, a lot of graphics, a lot of images that explain this process. I would caution you heavily that Medicare.gov is the source of truth. All of that information that's out there is, unless it comes from Medicare.gov, is editorial. So it may not be accurate or it may be out of date. So make sure that you're getting all of the numbers and all of the details from Medicare.gov. And working with an agent like myself can actually help figure out for you when or if you will hit that donut hole so you can be even more prepared. There are only two people who are exempt from this set of limitations. One person is someone who has creditable coverage for prescriptions in place. Again, that could be an active employee benefit plan from an employer as a health benefit given to you because you're an active employee. It can also be for prescription coverage. Medicare also considers VA prescription coverage to be creditable. So if you have prescription coverage through the VA, you can opt out of Part D. But if you don't have that creditable coverage in place and you do not enroll in a Part D plan when you become eligible, just like with Part B, there will be a late enrollment penalty, and it is a monthly penalty, and it will follow you for the rest of your life as long as you have Part D coverage. To be honest, the Part D late enrollment penalty is the penalty that I encounter the most with members that I work with, because what happens for a lot of people when they're turning 65, they think, I'm really healthy. I don't use a lot of services. I haven't been to the doctor in God knows how long, and I don't take any prescriptions. So why would I want to pay for health insurance for prescription coverage when I don't use prescriptions? Like, that seems like a waste of money. Well, the moral of that story is because in the long run, if you go 2, 5, or 10 years without needing that prescription coverage, but something changes and now you do, now your Part D coverage is going to be more expensive in the long run because you've got that penalty added every month for the rest of your life, as long as you have Part D coverage. That's more expensive than having paid for it from the beginning. So again, the moral of the story is making sure that you avoid those late enrollment penalties by making sure that you engage Part B and D at the time that you become eligible, unless you have creditable coverage in place. So those are just kind of the four parts. These are the only four letter names that are attached to the word part. So these are the pieces, the moving pieces of Medicare. Part A, Part B, original Medicare. Part D is your prescription coverage. And Part C is a Medicare Advantage plan, one of the types of insurance that wraps up Part A, Part B, and Part D coverage all in one place. So what are different scenarios that people could be dealing with when they are turning 65 or dealing with Medicare for the first time? One is that you're still working. So if you are over 65 or you're turning 65, but you're not retiring yet, you are still an active employee. As long as your employer has at least 20 employees, you can turn your Part A on, because there's no reason not to turn your Part A on at that time unless you are investing into a health savings account. If that is the case, I can work with you and help you understand what that means. I don't want to take the time to go into that detail because there isn't a lot of impact with that combination. But unless you are investing in a health savings account, you would want to turn your Part A on when you turn 65. But you do not need to turn your Part B on because this is considered creditable coverage. So you don't have your Part B on. You can avoid that premium for Part B, and you can stay on the employer-based plan that you have until such time that you do retire. If your employer has less than 20 employees, then you do need to make sure your Part A and B are turned on. Even though you can stay on your employer based plan at that point, Medicare needs to bill primary to help the small group plan out. So that's a requirement. So you do need to turn your Part A and Part B on as long as there are less than 20 employees with your employer. And Medicare then becomes primary. So any medical services that you have go first to Medicare, then secondary to your employer-based plan. However, between the combination of the payment deduction taken out of your paycheck to help pay for your um, employer benefit, plus the Part B premium that you'll now have to pay, that may not be the right solution for you. So, again, having a conversation with a licensed agent like myself can help you evaluate whether or not you should stay where you are under your employer based plan and turn Part B on, or if you might want to make a different selection that could possibly bring down your monthly premium and still provide you with adequate benefits that provide you the coverage you need. So, that's a conversation that you can explore at that point. Another situation might be that you are retiring, you're over the age of 65, and your employer offers you a retirement health benefit. This is a particularly designed type of Medicare Advantage plan that's called an employer group waiver plan, and it's called an egg whip for short. So if you ever hear anyone in the world of Medicare talk about egg whips, it's not what you think it is. It's actually a Medicare Advantage plan that's offered by that employer. Again, this is one of the two exceptions. This type of plan is one of the two exceptions to exposure to that donut hole or that coverage gap. The third scenario might be that you are over 65 and now you are retiring and separating from your employer's benefits. And now you don't get a retirement benefit offered by the employer because there are lots of employers who are not able to offer that benefit to their employees who do retire and separate from their full-time benefits. So if that's the case, then you make sure that your Part A and Part B is turned on, and then you can go and choose an individual plan from the market that works best for you. This can be a Medicare Advantage plan or a Part C plan. It also can be a Medicare supplement plan and a prescription drug plan, which is again the Part D separately. So there's couple of different ways that things could happen for you as far as your insurance goes when you turn 65. And again, making sure that you have all of your bases covered and know what to do, how to do it, and when to do it. That's where someone like I can help you come in and take a look at that and answer those questions. And so a lot of times, staying where you are is perfectly fine and all you need to do. But knowing that you're making that informed decision helps avoid those penalties. I do want to spend just a couple minutes talking about the difference between Medicare Supplement and Medicare Advantage because this is really confusing for a lot of people. Medicare supplement plans are one of the two types of insurance. In the English language, we use the word supplement to mean that any insurance that would go with original Medicare is supplemental to it. So don't get confused with how we use that term in the English language versus how Medicare uses that term in their language. So Medicare supplement, which is also known as Medigap, these plans were designed by Medicare to go with Part A and Part B. They control them, they design them, they tell us what is covered, which is only services covered under Part A and Part B. There's no added benefits and there's no prescription coverage included. They also tell us what, if any, out-of-pocket responsibility you as the beneficiary would have when you have one of these plans. These plans are called Plan and a letter. So plans G, D, and N, for example, are the most popular plans right now. So if you hear someone say that they have Plan G, you know that they have a Medicare supplement plan. Because these plans are designed by Medicare, they are standardized. So a Plan G with one company is exactly the same as a Plan G with any company anywhere in the country. And they utilize Medicare's network of providers. So you don't have to worry about whether or not the doctor you want to see takes your carrier Plan X. You worry about whether or not they take Medicare. These plans have a much higher monthly premium than the counterpoint of Medicare Advantage plans because they have very little, if any, out-of-pocket costs for services. However, like I said, you do have to purchase prescription drug coverage separately. So if you go the route of a Medicare supplement plan, you have your Medicare card, which bills first. You have your Medicare supplement card, which bills second. You have your prescription, your Part D card that covers your prescriptions. And if you choose a card that gives you dental, a plan that gives you dental and vision, that's a separate card. So everything is kind of a la carte. You can apply for a Medicare supplement plan at any time of the year as long as you have Part A and Part B in place. However, it's only when you become initially eligible or a couple of other circumstances when it's guaranteed that you are approved for the Medicare supplement plans. At that point, any new application, whether you're already on a Medicare supplement plan G and you want to move to a different company with plan G, or you want to go from plan G to plan N, that's considered a new application and it will go through the medical underwriting process, which means that the company you're applying with will take a look at your medical history, any pre-existing conditions, and your prescriptions that you use to make a determination of whether or not they can approve you. It's not a guarantee that you'll be approved at that point. You can apply any time of year, but it's not a guarantee necessarily. There are a couple of exceptions to that. And again, working with an agent can help you identify whether or not you have one of those exceptions and a guaranteed issue at that point. On the flip side of the coin is Medicare Advantage. Medicare Advantage plans, what happens is that the carriers have a contract with the federal government where we take over administrating your Part A and Part B benefits on their behalf. We wrap everything up in one place. So it kind of becomes one-stop shop, if you will. So your Part A and Part B is absorbed into the plan, but because Medicare is handing it over to us, we can add in additional coverage, we can add in the added benefits, we can include the prescription coverage, and because they're handing everything over to us, they're also giving us a lump sum per member to cover your Part A and Part B benefits, your premium, and the cost of administration of your benefits. So this is why these plans have a much lower premium, many options with a $0 premium, and they include all of the added benefits that you'd want to choose from. This makes this market an incredibly competitive market, but that works in your favor. And right now, we are in the annual enrollment period, which means that you have to have Part A and Part B in place to enroll in a Medicare Advantage plan. We never take a look at underwriting, but you also have to have an eligible enrollment period. So as long as you have Part A, Part B, and an eligible enrollment period, it's a guarantee to be approved for these plans. Because of this, this is a hugely competitive market. You'll see an explosion of advertisements, commercials, and billboards at this time of year, every year, because you have between now and December 7th to make any election for a change if you are a current Medicare member to the plan that you want to be in for January 1st. These plans do include different options as far as networks, so you want to make sure that you're doing the research to choose the appropriate network for you, because that's not necessarily a limitation if you get the access that you're looking for. And the plans do include prescription coverage, so you don't have to get that separately, and they do often include additional benefits. So I know I started a few minutes late. I don't want to take more time than my allotted time, so I want to move really quickly. I just want to show really quickly, these are some enrollment periods that are available. I just want to focus on the annual enrollment period before I leave you very quickly. Annual enrollment period is October 15th through December 7th of every year. The last application in by midnight on December 7th is what will stand in Medicare's system for effective date of January 1st. And I do want to provide my contact information. Please feel free to reach out to me. I'm happy to answer any further questions about Medicare in general, address any particular circumstances in your situation. I can help you map out whether or not you might enter the donut hole or whether or not you need to turn Part B on or need to find additional insurance. I can assist you with all of that. This is my direct phone number, 248-443-1131. And that is my email address. That's not a typo. They took the last letter off my last name. So it's erobinso@hap.org. Thank you very much for your time and attention today. Please feel free to reach out to me. I'm happy to work with you, answer any questions, provide any assistance that I can. whatever I can do to be a resource for the partners in the West Bloomfield Chamber of Commerce or any individuals who are listening or participating, feel free to let me be a resource to you for Medicare information. Thank you so much, and I appreciate your time today. Have a great afternoon.